This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
BAF Insurance is reminding you to get regular exercise, eat lots of fruits and vegetables, avoid fried foods that are loaded with salt and saturated fats, and limit your alcohol intake for a healthier heart. A healthy heart is a happy heart. A message from BAF Insurance, providers of affordable, flexible, quality health plans to suit every need. Call 949-5089 or visit bafcayman.com.
Good morning and welcome to Your Health, Your Wealth. This morning, we are on with some special guests. We have an interventional cardiologist from Baptist Health, Dr. Nish Patel, who's on with us. And this morning is going to be a bit of a happy story. So we're going to also have his patient, Mr. Rutty, who's a 91-year-old gentleman that lives here in the Cayman Islands, who's Caymanian, who lives right here with us, who actually became his patient, and he experienced Dr. Patel's expertise in actually literally saving his life. We're going to tell you a bit more, or we'll let them tell you a bit more in a bit, but that's just to get started. Dr. Patel, how are you?
Good. How are you, folks?
Great. Do you want to, okay, so this is, February is known as, or we celebrate it as Heart Healthy Month. So it's close to the end of the month, but what better time to have a good story, a nice story with a happy ending? Today's story is one of survival. So today we're talking to Dr. Patel and Mr. Rutty. Mr. Rutty was experiencing some health issues, and he was diagnosed as being in cardiogenic shock. Dr. Patel, tell us a little bit about what is cardiogenic shock.
So cardiogenic shock is essentially when the output of the blood from the heart is not enough for the rest of the body, and it causes your blood pressure to go substantially lower, less than 90/60, and the organs are not perfusing enough due to decreased output of the blood from the heart. That's what called cardiogenic shock in simplistic language. With Mr. Rutty, his cardiogenic shock was due to his valvular heart disease. And his valvular heart disease was severe aortic stenosis, which is essentially significant blockage of the aortic valve. Now, severe aortic stenosis, prevalence of that is more than 1% after 65 years of age, more than 3% after 75 years of age. But as the age goes more than 85, the prevalence of aortic stenosis is significantly higher. And that's what Mr. Rutty had. And his valve area was 0.6 centimeters square, which essentially means that the opening of the heart valve was only 25% of what it should be. Normal heart valve opening is 2 centimeters square. And that was causing his cardiogenic shock. And he was in Cayman Island when he had that.
Was he flown to the U.S. on a regular commercial flight, or did he have to be transported via air ambulance?
So he actually came through the private plane. He was stabilized enough that he can fly to Miami, and he came directly to the Baptist hospital, and we optimized him at the Baptist hospital, and then once he was optimized, we actually did the valve replacement on day 3. And after his valve replacement, he recovered significantly, and the next day he was discharged. And within a week of his discharge, family had a significant function. Also, his granddaughter was actually getting married the same week, and obviously the grandfather wanted to be in that marriage ceremony. initially we sort of didn't promise that he would be able to attend, but right after the valve replacement, he did extremely well. And in fact, he was able to attend that wedding also.
How intricate is the procedure?
Okay, so the valve replacement procedure that we did is called transcatheter aortic valve replacement. And that's essentially a replacement of the aortic valve by the catheter-based approach. Previously, the only option for the valve replacement was an open heart surgery, but now we have options available that we can do the valve replacement by the catheter-based approach. And in fact, in his situation, they evaluated for that aortic valve replacement to be done at Cayman Island also. But they thought that it was high risk for them, and therefore they recommended him to be transferred at Baptist Hospital. They shared the images also. In fact, he already had those images done because the most important part of that procedure is the planning of the procedure, and the planning involves the CAT scan of the chest, abdomen, and pelvis. And the CAT scan is to understand what's the size of the heart valve, and also to understand that what's the aorta and the femoral artery, which is the artery in the leg where we introduce the catheter. Are they big enough to introduce the catheter? And we also check the heart arteries by doing a cardiac catheterization to make sure that a patient does not have any major blockages in the heart artery before we do the valve replacement. So he already had those stuff done at hospital in Cayman Island. And so the planning phase was completed. We actually reviewed all those images, and we were confident that we would be able to do this procedure safely and help Mr. Rutty.
Mr. Burns, excited to have you on with us this morning because we're hoping that you're going to share your story with us about what was going on with your health before you actually ended up being introduced to Dr. Patel. Tell us a little bit about that.
Well, I live an hour from town, and I was on my way to town this particular morning, and was about halfway to town when my vision became blurred. It was like snow in front of me. So I said to my driver, instead of taking me to my destination, which was a business meeting, take me to my niece, who is a doctor, Dr. Diane Hislop. And on arrival there, she said, I'll put you right away in the emergency room of the hospital, which was within 300 yards of her office.
It was a good thing that you were actually in the right place at the right time then, that you were in like close proximity.
Certainly was, ma'am. And immediately I went into the ER and they took me into the, my blood pressure dropped, I think it was to 57 and
over 4.
Over 39. And then, of course, in the testing that they did there in the ER, they found that there was a murmur in my heart. So, of course, they transferred me then later on that day to the cardiology department. And, it was suggested that I should have a procedure done, which could have been done on the island, but the doctors here felt that in case of an emergency, they were better facilities in South Miami there at Baptist Hospital to take care of my situation. Well, my son went to college, University of Florida, with Dr. Mark Lewinsky, who recommended Dr. Patel, which was, thank God, that happened.
When you were still in the hospital here, Mr. Rutty, did they ever get your blood pressure to come up a little bit before you had to travel?
Oh, yes. Everything was back up, almost back up to normal, yes.
So that would have been very scary knowing that you're going on an aircraft and after you leave, there's like very little anybody can do to, try to stabilize your blood pressure.
I was very fortunate. I have a friend that has a big Lear jet, and he said I could have his plane to travel to Miami. My family went with me, my son, his wife, and Judy. We arrived in Miami Friday afternoon. Thursday afternoon, went to the hospital right away. And I saw Dr. Patel, examined me on Friday morning, and actually he was at the hospital waiting for me on arrival, which is unbelievable. And I was taken care of.
Yeah.
I was examined, and what did that have to do?
You were admitted, and then the Friday.
Oh, I was admitted. Then on Friday, they catheterized me. Something.
Judy, how was it? What was the experience like traveling with your dad, knowing he was that ill?
It was scary. You know, we kept looking at him to make sure he was breathing okay because we didn't have any oxygen on board. And I was a little bit nervous, but he was pretty calm. And then we went straight to the hospital, and Dr. Patel was right there in the ER waiting on us. They started, getting his IV hooked up and got him a room, put him in there. And then starting on the Friday, they started running heart catheterization to make sure there were no blockages so he could do the procedure on the Monday. To meet him, he made us feel a lot better about Daddy's condition.
Okay. And on Monday, when he had the procedure, how long was he in the procedure?
Asked Dr. Patel, not very long.
Okay, Dr. Patel, how long was this procedure?
So the procedure, takes only about, 30 to 45 minutes. The most important part of the procedure is, prepping the patient on the table. But the procedure, once we access the artery to the valve replacement, 30 minutes to 45 minutes of the procedure time. And that's why the planning is extremely important, and looking at the CAT scan and making sure that you go in with plan in mind, and 70% is planning and 30% is just executing that plan in the procedure room.
Mr. Rutty, how was the wedding when you got back to Cayman? How was your granddaughter's wedding? How did that all work?
Well, it was at a great location. It was at Pedro St. James Castle. Beautiful wedding. All went well. I attended the wedding ceremony at the church, and then, of course, I went to the reception, which is at Pedro St. James. Very scenic area. It went beautiful, quite a way. But I didn't stay to the very end of the reception. I went on to like early hours of the morning. I went home before midnight. But I was feeling good. I felt good ever since I've had that surgery. I felt good, and I'm going to my boat. I drive my car. Every afternoon I go to my pool and do my exercises. I'm back to normal, really, and I'm very happy. I've been traveling, live a normal life, and I'm gonna have a birthday reception next month on the 9th of March when I hit 92.
Awesome. And I guess you're going to be living for like another 50 years because you sound strong enough to be with us for that long.
Well, I tell you what, I have a lot to accomplish. I got plenty to do. It will take 50 years to do some of it too, looks like. I'm a very positive thinker, and I never think negatively. I knew that I'd be taken care of, and I'd be able to come back to Cayman and do my duties, socialize with my friends and family, and just live a good normal life, which I'm doing right now. Every night I go out and meet my friends and have a glass of wine, and we socialize and we do things together. We go snorkeling, we go fishing, I'm a boat person. I'm not a golfer. I'm a water person. I love the water.
Okay.
It's amazing. Yeah, he lives life to the fullest, and we can't keep him down. So we let him do whatever he wants to do. We can't stop him.
Right.
And we're fortunate to have him at almost 92 now, because a lot of our friends have lost their fathers.
Yes.
And we're very fortunate to have him. And thanks to Dr. Patel, we have him longer.
Yes, that's correct.
Dr. Patel, what are some of the risk factors and some other medical conditions that sometimes lead to heart ailments?
Lead to cardiogenic shock?
Yeah. Yes, sir.
Yeah. So heart's, essentially a pump, and it has electrical activity also, and the arteries provide blood flow, which are the pipes of the heart. So any issues with the electrical system or heart artery, which are the pipe of the heart, or any of the valve, which is a plumbing issue. Any of those can cause cardiogenic shock. So let's say if you have a blockage in the heart artery and it's causing a heart attack and it's involving one of the main artery, that can cause cardiogenic shock. If you have any arrhythmia, which are deadly, that can also cause cardiogenic shock. And any issues related to valve, significant blockage or leakage of the valve can also cause cardiogenic shock. And when you have that, cardiogenic shock is pretty lethal condition, because a patient who presents to the hospital with a cardiogenic shock, the risk of mortality, which is the risk of dying from that, is almost 50% during that hospital stay. So it's not a benign condition. And the valvular heart disease, which Burns had, severe aortic stenosis, when you have that, and when you start having the symptoms, which is fatigue or difficulty breathing, once you start having that symptoms, the risk of mortality, which is a risk of dying, is 50% at 2 years. So it's also, like having a stage 4 lung cancer or a breast cancer. So therefore, once you have a diagnosis of severe valvular heart disease, we tend to sort of move quickly and wants to have it addressed as soon as possible, so we can prevent the subsequent worsening of the heart. And the cardiogenic shock is one of the last stage of that worsening of the heart. So those are some of the issues. And the risk factor, aging is one of the risk factor. As you grow old and age is more than 65 years of age, diseases of the heart are more common. And globally, the cardiovascular disease is the number one killer globally. So age is one of them. And then men, so gender of men is a higher risk of having a cardiovascular disease also sooner than the woman. And high blood pressure, high cholesterol, those can obviously cause blockages in the heart. Type 2 diabetes mellitus is also one of the major risk factors. And for the valvular heart disease, the most common risk is aging. As you age, the valves have a higher risk of having a degeneration. And if you had a rheumatic fever as a child, that can also increase your risk of having a valvular heart disease. And there are some patients who are born with what's called bicuspid aortic valve, and that is also a risk factor for having a valvular heart disease sooner. And sooner means in their 50s or 60s.
Dr. Patel, another question: Would you credit Mr. Rutty's survival to an accurate diagnosis that by going to his niece's office and her looking at him and saying, like, look, you need to be in the emergency room, would that have also assisted him at his survival?
Yeah, absolutely. Having picking up that murmur and directing him to the emergency room and getting all the workup started for sure played a significant role. But I would also recommend for any individual who's more than 65 years of age, and whenever they seek medical attention, whenever there's a murmur noted on physical examination, they should always follow that up with the echocardiogram, because the murmur in older individual is most likely associated with pathological valvular heart disease. There are some situations young individuals have murmur, but those are called flow murmur, and those are benign. But once you're old, after 65 years of age, if there's a murmur noted on physical examination, that should always be followed up with the echocardiogram to make sure that there's no major valvular heart disease. And if that's the case, they should seek an evaluation by a cardiologist, because some situation that would be the first sign of the valvular heart disease. And sometimes what happens is patients after 65 years of age, when they have a significant valvular heart disease, they may be symptomatic, but they blame the symptoms to their old age. and they think that must be the aging. That's why I'm feeling tired. But sometimes there would be something which is easily addressable and can increase the patient's life expectancy.
Dr. Patel, since we're wrapping up, I want you to speak to the men in the Caribbean. Well, I mean, we have an international audience, but I want you to specifically speak to the men in the Caribbean, because we all know that Caribbean men do not like to go to the doctor. They will stay at home and self-diagnose, and they will also say, like what you say, as they get older, is, oh, it's just old age or whatever. I want you to, in the last moments that we have together on this radio interview, I want you to tell us the importance of having whether it's your dad, your brothers, whoever you know, but not just as males, but also the entire family. But get us all on board and tell us why it's so important to have proper checkups that include tests that could pick up, like you said, like something like a murmur. You would follow that up, like, you would go a little further. So tell us what the importance is of these
Absolutely.
checkups.
So, I would like to tell all my Caribbean friends, I think that the God has given us 100 years. So, I'm a doctor, I believe in science, but at the same time, I'm a spiritual person also. And I truly believe in this, that the God has given us 100 years to live. If, you reach the adulthood without any major, birth defect, and if you live your life, the way it's supposed to be, you can easily live 100 years. But for that, after 40 years of age, seeing doctors, primary care physicians, and making sure that, they're following up on high blood pressure, high cholesterol, also screening for diabetes, because those are some of the major risk factor which can affect your heart. And as we know that the heart is number one cause of your death when you grow old. So if you take care of the heart, you would be able to live longer. And as I mentioned, after 40 years of age, seeking the primary care physician's evaluation, and the primary care physician, if they find something, they can easily refer them to a cardiologist. And as I mentioned, specifically, if they find a murmur, then refer to a cardiologist for the further evaluation with the echocardiogram. And some of the symptoms that you should also be looking out for is fatigue. Fatigue is the number one symptoms which happens before anything major symptoms sort of start happening. So fatigue, having a chest pain, difficulty breathing, the things that you were able to do 6 months or 1 year ago, you're having difficulty doing those things. Passing out episode, feeling of passing out. Those are some of the symptoms which are potentially arising from your heart. And if you have those, you should always seek, evaluation by your physicians. It could be primary care physician, and primary care physician is the person who would be screening all those issues out. And if there's something needed to be addressed, they would refer you to a cardiologist. But folks, you should go out, seek medical attention by your primary care physician. And even if you're feeling completely fine, I tell all my patients and some of the friends also that how we are able to take care of our cars. We don't have to tell anybody doesn't have to tell us that, okay, it's time for your car to have an oil change and have a service. But we don't take care of our body like we take care of our cars. So, take care of your body more than you take care of your cars. That is my, concluding remark.
And if you take care of your body will take care of you, right?
Yeah.
Thank you so much for being on Your Health, Your Wealth. And thank you so much for being such a willing guest on the show, to both yourselves and Mr. Rutty, and also to Mr. Rutty's daughter, Judy, for being there, because the side story adds to the flavor of the whole interview as well. So thank you so much.
Your health, your wealth, your health, your wealth, your health for life. Your Health, Your Wealth is brought to you by BAF Insurance. Your health, our priority.
BAF Insurance is reminding you to get regular exercise, eat lots of fruits and vegetables, avoid fried foods that are loaded with salt and saturated fats, and limit your alcohol intake for a healthier heart. A healthy heart is a happy heart. A message from BAF Insurance, providers of affordable, flexible, quality health plans to suit every need. Call 949-5089 or visit bafcayman.com.
This program is brought to you as a community service of BAF Insurance. The views, opinions, and advice expressed by guests on this show are those of the guests and do not reflect the views, opinions, and advice of BAF Insurance. For medical advice, please visit your medical professional.